Good afternoon, everyone. We're about to get started, but first I'm going to add our special guest, so give me just 1 second to do that. Thank you, everybody, for taking the time to spend with us this afternoon. Hi, Laura.
Hello.
How are you?
Good. How are you doing?
Good. I'm just going to turn you up real quick. Okay, so thank you so much for joining us. Thank you, everybody at home, for watching. We are now officially in, unfortunately, week 3 of the federal government shutdown. Even more unfortunately, Speaker Mike Johnson sent all of Congress home weeks ago and refused to bring us back and is canceling votes left and right. I am in Washington. I've been in Washington this week, last week, the week before, doing everything in my power to negotiate a bipartisan budget deal that reopens the federal government but doesn't put the health care of 20 million Americans and more at risk. And so that's the moment we're in, and House Democrats are fighting for more than just reopening the government. We're fighting for preventing skyrocketing healthcare costs on January 1st. So I wanted to make sure we had this conversation. We've been talking a lot about healthcare, and I've always found, Laura, you know this really well, we talk about healthcare in numbers and at the 30,000 foot view, and we don't always talk about it on the individual personal level. And so I'm so grateful to have our very special guest, an expert at the forefront of healthcare policy, Laura Packard. Laura is currently the executive director of Healthcare Voter and the founder of Voices for Healthcare Action. Healthcare Voter is a national campaign to hold elected officials accountable for their votes on healthcare and support those who fight to protect our care. And Voices for Healthcare Action helps organize adults with serious medical conditions to tell and share their stories and advocate for affordable, comprehensive healthcare. Laura has been a longtime advocate for healthcare ever since 2017, when she was diagnosed with stage 4 cancer. And thankfully, she has been in remission ever since, but not without extensive treatment and activism to defend her healthcare. So welcome, Laura. Thank you for making the time today.
Thank you for inviting me.
Yeah, I'm going to get right to it. And I have a number of questions. And of course, if I'm able and fast enough to click on the comments here to see them and ask, we'll engage in comments too. But number one, you in 2017, you were diagnosed, as I mentioned, with stage 4 cancer, Hodgkin's lymphoma. And you often say that the Affordable Care Act, or what we'll call the ACA for this conversation, the ACA saved your life, which is a story that I fortunately and unfortunately hear a lot, very often from constituents. Can you speak to how the ACA helped you access that life-saving care that you needed in that moment and still helps you today?
Sure. Well, I'm a small business owner, and so my insurance is through the Affordable Care Act. And before the ACA, I used to have junk insurance. And actually, I've done some Googling, and the insurance policy that I used to have, cancer patients or the survivors of cancer families have sued for that insurance company dropping their care, not providing their care when they got cancer. So that could have been me. And the 6 months of chemotherapy and month of radiation treatments I went through was not cheap. It was hundreds of thousands of dollars to save my life. And so without the Affordable Care Act, today I would be bankrupt or I would be dead.
And again, I hear this story so often from my constituents. It actually reminds me, my grandmother, when I was very, very young, went through something similar. And I remember thinking as a child, how can she possibly balance all of these things? How can she focus on her treatment and stay at work to keep her insurance? And the ACA provides that really necessary safety net for a lot of folks. And to your point, I'm just going to double down on what you said. For small business owners and entrepreneurs and small farmers, is something we're starting to talk about a lot. A lot of farmers utilize the ACA for healthcare coverage. So thank you for sharing that. During the time you were battling cancer, you were also fighting attempts by Congress in the first Trump administration to repeal the ACA. And I've lost track of the dozens and dozens, if not over 100 times, my Republican colleagues before I got to Congress attempted to repeal the ACA. But the fight to protect the ACA, unfortunately, continues to this day. But what do you think is the difference about this moment from the 100 plus prior attempts?
Well, first of all, nobody should have to go through what I went through, which was going to cancer treatments and then turning on the news to figure out if I still had health insurance. In fact, the day after my first chemotherapy appointment was when Republicans in the US House voted to repeal the Affordable Care Act. And then they held a party to celebrate. So while I was on my couch recovering from chemo, they were partying. So 8 years later, here we are again, where they're threatening our health care. And they succeeded in that they passed a big ugly bill that threatens Medicaid. There's over $1 trillion of healthcare cuts through Medicaid, even Medicare, and the Affordable Care Act. And what they failed to do when they were prioritizing spaceships for Elon Musk was to extend the tax credits that let small business owners and freelancers, gig workers, people that retired and are not yet eligible for Medicare, people who lost their job and lost their work health insurance. All of these people benefit because of the safety net of the Affordable Care Act. And many of us will not be able to afford health insurance if Congress doesn't step up and pass this help.
And I want to bring us back to a moment, when the ACA passed, and I've heard my colleagues in Congress who were here talk about the moment where they decided they were in caucus and they decided we're going to go do this. And they decided to walk above ground. They didn't use the tunnels, and they knew that that was a risk because they were going to get yelled at by the protesters, but they exercised this courage to do the right thing. It was really politically risky at the time, and not as it was, as liked at the time, that policy decision. And since then, we have literally experienced the theory that was the ACA, that the more people who are insured, the better health outcomes for everybody. Because if folks don't have insurance, they're not going to have a primary caregiver. They're going to get sick because you can't help that. Instead of going to your regular doctor, you're going to go to the emergency department, which is going to result in, we in Maryland experience crazy wait times already at our emergency department. That puts pressure on our first responders, pressure on the hospital. And then the hospitals have to pick up what's called uncompensated care because they have an obligation and a duty. And I would hope all Americans agreed with that obligation and duty. When someone shows up at the hospital sick or bleeding, they are treated. And the ACA spread that insurance pool out to include more healthy people and thus better health outcomes for everybody. Like, this was a concept I thought was accepted by my colleagues in governing, that it's a good thing for people to have health insurance, but they can't do that, to your point, if they can't afford that health insurance. And so we have to do everything we can. And I'm not going to sit here and defend a system that's pretty broken, but at the same time, people deserve to have health insurance so they can be healthy, to your point, and so they can get access to life-saving care. Okay, I'm going to get off my soapbox and talk about, we are seeing, you mentioned this before, but unprecedented attacks on healthcare by this administration. The big ugly bill that was passed on July 3rd. I can't tell you how many nights I slept on my couch in my office because we were voting through the night trying to slow that thing down. You mentioned, and it's worth doubling down on, was the biggest cut to Medicaid in US history. And in addition, triggered cuts to Medicare. And on top of it, we're now in this ACA premiums tax credit fight, which is what has subsidized a lot of people's access to their health insurance. I want to talk about that all went down. And in addition, sorry, I forgot one thing. The president's just absolutely bananas decision to slap 100% tariff on foreign imported pharmaceuticals, which is going to exacerbate this crisis that we're in. But can you explain for the folks at home how all of these actions impact the larger system? So even if you don't receive Medicaid, or even if you're not on Medicare yet, or even if you're not on, you benefit from these ACA tax credits, how is the whole system impacted?
Well, going back to what you said about uncompensated care, hospitals will treat somebody even if they don't have the money to pay. And so, how hospitals keep their lights on and their doctors employed is they then charge the rest of us. And so, we all pay for that uncompensated care in higher premiums. And so, as more and more people lose health insurance, the people that do have health insurance are going to pay more and more to make up for it, and or hospitals and clinics will just close because the math no longer works out. And we've already seen several hospitals around the country announce closures and have closures. So that in turn, whether or not your hospital closes, if a hospital anywhere in a 2-hour radius of you closes, all those people who still need care are still going to need care. And so they're just going to go to a different, further away emergency room and hospital, making your wait times for your hospital even more. So cuts to Medicaid, even if you don't have Medicaid, cuts to Medicaid mean that you're going to pay more for your health insurance and you're going to wait longer for your care at wherever you get your care.
It's a whole system. I know a lot of folks understand that, but I've said this a lot in the last couple of weeks. My job as a member of Congress is to respond when bad things happen, but also do my absolute damnedest to prevent bad things from happening. And if we do not extend those ACA tax credits now, people already got letters from their insurance companies on October 1st. The open enrollment starts on November 1st. The premium increases kick in on January 1st. There's this notion that Speaker Johnson is trying to put out as a defense right now that he won't negotiate during a shutdown, which is crazy. And let me just say, we've known about the September 30th ending of funding for the government since March, folks. And so we should have been negotiating this entire time. But in addition to that, the insurance market is not going to wait for Congress to get its shit together. Like I said, they're already putting out these rate increases for January 1st. And so we need to come back to Washington right now. That's why I'm here every week to try to force my Republican colleagues back to the negotiating table. It's our job. In Maryland, I mentioned 20 million Americans benefit from these ACA tax credits that we're fighting over right now. Of that 20 million, about 190,000 live in Maryland. And they are expected, if we do not act, to see a 95% increase in their premiums. Things are already too expensive. Housing's too expensive. Childcare, groceries are a BG&E bill. Healthcare, pharmaceuticals, already too expensive. To be able to withstand a 95% increase is just not going to work for a lot of people. And it's going to put health insurance out of reach, and thus health care out of reach for too many families. Okay, I'm on my soapbox today. I think I've had too much coffee. But I have one final question for you, Laura. You have taken your experience, your personal experience with the ACA, with the healthcare system, and you have turned it into something that is bigger than yourself. And first of all, thank you for doing that. It really matters. You are empowering people to be their own best advocates and teaching advocacy to people across this country. I often get the question at every town hall we've done, and even at the grocery store the other day, someone asked me what they can do to be helpful. So what is your best recommendation for folks at home who care about healthcare, who are worried about this bill they're going to receive on January 1st? What do you say to people? How can they protect their healthcare?
Okay, well, first of all, if you live in Maryland, New Jersey, New York City, the state of Pennsylvania, the state of California, and many other places, you have an election coming up very soon, and the people and policies on that ballot will have a lot of effect on whether you have affordable health care or not next year, because these cuts, this budget bill is federal, but it's actually your state that has to figure out how to implement those cuts and what they prioritize or don't with their state budget. So again, if you have a local state election, vote, because your vote is critical. And then contact your representatives. If you, whether or not you have a U.S. representative or senators that support healthcare or not, they need to hear from you, especially if they don't support making the Affordable Care Act more affordable. They need to keep hearing from you. So keep calling them and make sure that they know that this is a top priority. And surprisingly, sometimes you can even get through to somebody that was opposed. Like, I'm sure Marjorie Taylor Greene never thought that she would be supportive of something that was called Obamacare. But here we are, because the small businesses, the people in her district kept calling and calling and calling. And so she's aware that her constituents need affordable health insurance. So even if you think you couldn't possibly get through to your elected officials, because not everybody has a great U.S. representative like you, but keep calling, make sure they hear from you, and you can tell your story if you feel comfortable writing a letter to the editor, going to a public event, like there's going to be protests this weekend all over the country, that you can go speak out about healthcare, make sure people know that this is important, and keep speaking out, because a majority of Congress passed these cuts, and they will do again and or worse unless they hear from us that this is not okay and that we are not okay about it.
That's such great advice. And my office, we're working through the shutdown. None of us are taking a paycheck here, but we're answering every phone call, responding to every email. And we've heard from hundreds, if not thousands, of constituents just in the last few weeks alone. I want to reemphasize that, our whole country was founded in this idea of self-governance, and self-governance cannot work if folks don't participate and lean in and share their viewpoints with the people who are elected to represent them, whether they agree with you or not. And I completely agree. I get a call log every evening. It's how I end my day, of everybody who's called my office, and I get to see firsthand what they've called about. And I wish every one of my 434 colleagues did the same thing right now, but they still need to hear from you. And so Laura has a really great point. If you live in a community or a state that is represented by somebody who might not vote like I do or fight for the things I fight for, you should, exercise your right to petition your government. That's what the Constitution says, and that's what it means to call your representative or send them a personal email and really make sure you put a face on these numbers. I can say 20 million Americans every day, but it's really the life stories like yours, the fact that this is a benefit to our economy, the fact that more small business owners can go out on their own and support our economy because they have access to healthcare because of these ACA tax credits. Those stories need to be heard. So thank you so much for joining. Thank you for your advocacy in the darkest of times, which we're experiencing right now. I really appreciate it. And then I'll just end by saying, for those watching at home, I'm not giving up on reopening the government. We have to reach a bipartisan budget deal, but not at the expense of 20 million plus Americans' healthcare. And so we are fighting for all those things. You all sent me here to do hard things, and I'm here to do them. So Laura, thank you so much. I really appreciate you joining us today.
Thanks for the invitation.
Of course. Thank you everybody for watching at home.